Some people have compared the developing young child to a rocket taking off. Disruptions in health or emotional functioning during takeoff can alter the whole path of the child's life. Mother's milk is the optimal form of nutrition during this critical period when the brain is being wired and when the immune and endocrine systems are being programmed. In addition to the many health benefits to infants, breastfeeding also offers many health benefits for mothers. The hormones that circulate in the mother's system due to breastfeeding help to reduce postpartum bleeding and to prevent the baby blues. Because breastfeeding consumes so many calories, mothers tend to return to their pre-pregnancy weight more quickly. Most breastfeeding mothers experience a long delay in the return of their normal menstrual cycle. This is nature's way of spacing out babies so that mothers can adequately feed one baby before having another. Women who have breastfed also have a lower incidence of breast cancer, ovarian cancer, and osteoporosis later in life. Working moms benefit from healthier babies and less missed days of work or school. Mothers who have successfully breastfed often describe feeling very gratified by the experience and very emotionally bonded to their baby. Breastfeeding also gives a mother a sense of empowerment. She knows that she is giving her baby something that nobody else can provide. For a working mother who must leave her child in another person's care, continuing to express milk during her workday can help her to feel that she is providing something important for her child even when she can't be with him. While accommodating breastfeeding mothers requires time and space for pumping breaks, employers directly benefit from this investment. According to the U.S. Surgeon General's report, these mothers tend to be more productive. They miss work less often to care for sick children and cost the company's health insurer less. They also tend to be more satisfied with their work environment and thus less likely to resign and cost the employer in terms of recruiting and training a replacement. In the long run, workplaces save when they support breastfeeding. There are economic costs associated with not breastfeeding. These costs affect not only individual families, but also our whole society. Formula is expensive. Infants who get sick more often cost their parents more money in terms of healthcare costs and missed days at work. Employers also bear much of the financial burden. If an employee's infant is homesick, that employee cannot do her job and is more likely to eventually quit her job. Employers often pay for their employees' health insurance. So if healthcare costs are higher when infants are not breastfed, this costs employers in the long run. A recent study that evaluated healthcare costs associated with conditions that could have been reduced with breastfeeding, sudden infant death syndrome, hospitalization for lower respiratory tract infection in infancy, atopic dermatitis, childhood leukemia, childhood obesity, childhood asthma, and type 1 diabetes mellitus found that if 90% of U.S. families followed guidelines to breastfeed exclusively for 6 months, the United States would save $13 billion annually from reduced direct medical and indirect costs and the cost of premature death. Breastfeeding is also better for our environment. The production and distribution of formula involves the use of farmland, energy for factories, gasoline for transportation, and landfills for the disposal of packaging.